We are going to talk about the impact. I'm going to focus on the African American community, some tips for staying safe, a summary, and questions. Some of this may be things that you've already heard, but it's always great to hear things more than once to be able to fully understand them. And I apologize for those who are on the phone. Most of my presentation is visual, but I will be talking through everything that is on the slides as well. So you should be getting the same amount of information just without the little bit of visual. All right, so we're going to talk about some myths. The way that I'm going to do this presentation is we're going to debunk some myths here that have been going around about coronavirus. So the very first one under the heading of the basics is that coronavirus has been around for a long time and it is man-made. This is something that I have seen in the media, I have heard in the media, it is all over the place. And this is an absolute falsity. It's the truth is that the coronavirus is a brand new virus. This is something that has never been seen before in the US, in the world. It is not man-made. To most of our knowledge, we're 99% sure that it is not man-made. So it technically, it is called SARS-2, which is the name of the coronavirus. And that's because coronavirus itself is a family of different viruses. So a lot of people have been saying that the coronavirus has been around for a long time because they've seen the words coronavirus on the back of the Clorox bottle or the Lysol bottle saying that they kill coronavirus. And coronavirus itself is a big family of viruses, of which the new coronavirus, SARS-2, is a part of. And I made this little chart just to kind of show you, it's like a family tree. Coronavirus family has 3 different types of viruses, and the one that's highlighted is the one that we are talking about that is happening right now. You may have remembered in the early 2000s that there was an outbreak of something called SARS. And then in 2012, there was something going around called Middle Eastern Respiratory Syndrome that was isolated mostly to the Middle East and in the Egypt region. But now what we're talking about on the right-hand side, so that you are clear whenever you hear about coronavirus, is what is known as SARS-CoV-2. That is the new version or new virus in this family of coronaviruses, and it creates the disease known as COVID-19. So when you listen to the media and different sources, I just want you to have an understanding of what you're hearing, because some people may refer to the coronavirus, the one that we're dealing with now, as SARS-CoV-2, which is its scientific name. Some may talk about it as COVID-19, and COVID-19 is specifically the disease that it causes. But just so you know, it's not man-made, it is brand new, and it's something that we are dealing with for the first time. The next myth that I wanted to debunk is how coronavirus is spread. So many of you have probably, like myself, heard on TV or read in the news or seen on social media that people think that coronavirus is spread through 5G waves, buying materials off the internet, food, dirt, packaging, all sorts of things. And the one thing that I want you guys to know is that coronavirus is spread through small drops that we sneeze or cough. So it's not created or spread through all of these different ways of which we have heard that it could be spread through. It is primarily spread through small drops that happen when we sneeze or cough. And what happens is when you sneeze or cough in relation to someone else, if you're very close to them, what happens is sometimes some of those things that we cannot see will land on us and we infect ourselves. Coronavirus enters the body through 3 different ways, and that's through your eyes, your nose, or your mouth. And that's how most viruses are contracted. So anything that you hear that says that coronavirus is spread through any other ways is fake. It's not true. It is spread only through small drops that we sneeze and cough. Another one of the myths is that the COVID-19 disease always has really bad symptoms, and most people who have it will die. So one thing that I want to stress is that what we see in the media is oftentimes some of the worst case scenarios of things that happen, and it can spread a lot of fear in people. And it is a very severe and deadly disease. However, the most common symptoms are fever, shortness of breath, and cough, or no symptoms. So roughly about 20% of people, so that's 1 in 20 people, will have to go into the hospital because of complications due to COVID-19 or the coronavirus. But not every single person who has the coronavirus will have to go into the hospital or will have symptoms or they will die. So while it is severe and it is something that we should take very seriously, it's not something that it's going to kill every single person who has had it. If that were so, then we would be in a lot of trouble because of all the people who have contracted it. This little figure that I have on here is of the lungs in the body. So coronavirus, it particularly attacks the lungs. It can attack other parts of the body, but it attacks the lungs, which is why you will get the shortness of breath and a cough as well. And what happens in the body that makes it kind of go haywire and go crazy is that it also activates all of our immune cells, the cells that fight to keep us safe and healthy. And it can have the ability to make the cells that keep us safe and happy attack our own body. And so for those people who get very sick, what's happened is that their cells that are supposed to help us are no longer able to help them. And therefore other sorts of bad bacteria, viruses, other sorts of diseases can enter into their body and cause them to have very serious complications to it. So this last myth that I want to talk about under the basics of coronavirus is that there's a cure or vaccine that the government is hiding from people. So I've heard this several different times, that the government or celebrities are able to get a hold of a cure or a vaccine, and that's the reason why certain celebrities and certain people, government officials, are not contracting the coronavirus. And that is completely false. Currently, there is no cure for the coronavirus. That is not to say that if you were to get the coronavirus, you would not live, which is what we just talked about on the last slide. What it means is that there is not a medicine that any doctor or nurse or anyone can give you that will take the coronavirus away. Just like the common cold, most viruses have to work their way through your body, and they have to be able to just kind of clear on their own. So coronavirus, just like the common cold, does not have a treatment for it or a cure. What we do when somebody gets sick is the same things that we do if someone were to have a cold. We support them with fluids. We support them with medicines that help them breathe better, and things like that. But there is no cure. And there have been many reports of people saying that those who have coronavirus or who do not have coronavirus and want to prevent it should either drink bleach or Clorox or Fabuloso or whatever household product you have in your home. That is not a cure. That is not a prevention. That is a sure way to death or poisoning. So please do not do that or listen to anyone who does say that. There is no cure and there is no vaccine yet. Right now, there are many different labs throughout the United States and also here in Maryland that are working on a vaccine. And at the earliest, it will be at the end of this year. But this is just to say the things that you hear on TV or that you read about in the news or in the paper, there is no cure. There has been a big interest in the drug hydroxychloroquine that many people have heard about. And that drug is used to treat malaria. And it does not have any effect on coronavirus. And it has been proven to not have an effect, to which the United States government is no longer funding any research to look into if it has an impact on coronavirus. So if you hear someone who's taking that, or people are buying it off the internet, please do not, because it is a very, very toxic drug that can cause many different side effects and will not cure coronavirus or prevent it as well. So I wanted to talk about the impact on coronavirus and kind of focus on a more global picture, and then look at the United States, Maryland, and then kind of look at the impact that it has had on the African American community. So one of the myths that I have heard while watching TV or just kind of going around is that coronavirus numbers that we see on TV or that we read in the paper are not real, and that it is a Chinese-only virus. This is completely false. Coronavirus is real, and the numbers that are being reported are very real. And what I wanted to show you, and for those who can't see my screen, what I'm showing is a map of the world. And what we see here is that in total right now, we have over 5.4 million cases of coronavirus throughout the world. And the bulk of those are in the United States. And we are almost at 350,000 cases in the world. And I showed this because there have been a lot of people who've been spreading false news that it is only in China. We should only worry about it in China. In fact, China is a giant, very, very big country, but it does not even make up the world's population or the world's most amount of cases. In fact, the United States does. So coronavirus is real, the numbers are real, and even if you're not seeing it impacted in your community or in your family or anyone that you know, it is very real, and it's very rampant right now in the United States and across the world. The second thing that I've heard people saying regarding coronavirus and its impact is that the United States is doing better than any other country, and coronavirus cannot harm us. The United States has a long history of thinking that we are the best in the world at many different things. And this is not one of the things that we want to be the best in the world at, and saying that we are great at coronavirus and not helping out other countries, as has been placed in the media. The coronavirus has, in truth, what I'm showing is a map of the United States. And as I said in the previous slide, the coronavirus has greatly impacted the United States more than any other country in the world. So far, there have been 1.6 million cases of the coronavirus in the United States, and we are far above any other country with the amount of cases that we have. And before the week is over, we will have over 100,000 deaths in the United States alone. And I show this because it is very important for us, even though we may not see it in the counties or the cities that we live in, that we know that this is impacting a lot of people in our country all over. And the United States, no matter how great we are at many other things, we have not been able to prevent the spread of this disease because it impacts everyone and anyone. And we have not been spared from that. So what about here in Maryland? What's going on in our own state? So something I've heard since Maryland decided that it wanted to reopen is that people think that because we are reopening, Maryland is doing better than most states. And I had been following coronavirus and the data and all of the numbers for a very long time before putting up this PowerPoint or making this presentation. In the past few days, I had not been looking at the numbers as much because it can get to be very overwhelming. But I was very shocked to find out that in truth, Maryland is the number 10 out of 50 states for coronavirus cases and deaths. When this started, we were in the top 30. And over the past few weeks and months, we have climbed to be number 10 out of the 50 states for the number of cases that we have and the number of deaths. So on both lists, we are number 10 out of the 50 states, only behind New York, New Jersey, and California, and a few other more populous states. So we are one of the states that is a pretty small state, but we make up a significant amount of the coronavirus cases and deaths here in the United States, in our small little state of Maryland. And so, since I'm talking to people who live predominantly in Cecil and Harford County, I wanted to kind of just point out where we are with the numbers there today. So as of 10 o'clock this morning, Cecil County has 353 cases of coronavirus and Harford County has 795. So as you can see from the map, or if you can't see from the map, what I want to say is that the state has many, many different hot areas of coronavirus, that being Montgomery County and Prince George's County, as well as Baltimore City and Baltimore County. But even though Cecil and Harford County do not have as many cases as the other parts of the state, everyone can be impacted. Harford County is but one couple steps over from Baltimore County. And Cecil County is only a few steps from Harford County. So it just takes a few people to come from any part of the state or anywhere in the United States to come through and carry the disease and to increase these numbers. So with this kind of in mind, I wanted to spend the rest of my time talking about what its impact has been on the African American community. So one of the myths is that in the United States, everyone is being affected by coronavirus in the same way. While it is true that coronavirus does not, the virus itself does not discriminate. The virus will affect anyone regardless of their race, their wealth, their job status, their housing status, etc. The virus is not the only thing that comes into play when someone gets sick. So the virus, like I like to say about all viruses and bacteria, they're stupid. They don't have any brains. They can't do anything. So in order for there to be an issue in the numbers that we see when it comes to a virus or any sort of thing like that, it is man-made conditions that create discrepancies in health and differences in health. So while the virus itself, because it's dumb, it will impact anyone, because of the way that the United States is set up and the way that our systems are set up, Black and African American populations are the most vulnerable group outside of Native Americans in the United States right now. And in the state of Maryland, where we do not have an indigenous population of Native Americans, Black and African Americans are the most vulnerable group, period. Of any group, Black and African Americans in the state of Maryland are the most vulnerable and the most likely to get coronavirus and the most likely to die from coronavirus. In the United States, Black and African Americans are 2 times more likely to be hospitalized with coronavirus than any other racial group. And this has been a big point in the news, and it's not something that we have not seen with other diseases. However, with coronavirus being a disease that has been talked about a lot in the media and is very big right now, and we're trying to control it, it has shed light on many of the injustices and all of the bad things that we know have happened in regards to healthcare for African Americans. African Americans in the United States make up 13% of the population. And at this time, they make up almost 30 to 45% of the deaths. And when you think about that, in a disease that knows no race or creed, it shows that there are systematic and other types of things in place that have made it so that African American communities have been so hard hit by this disease. So I'm looking at this, was very disturbing for me to look at today. This is a chart that shows the deaths broken down by groups of race. And this shows that Blacks or African Americans are the group with the most deaths. The green bar, sorry, trying to find my mouse. The green bar here is African Americans. And for those of you who are on the phone and cannot see it, what we're seeing is that for every 100,000 people who are dying, 50 African Americans would die, as opposed to in the Caucasian community, for every 100,000 people who die, only 220 would be white. So what this is telling us is that in the United States alone, Blacks and African Americans are more than 2 times as likely to die from coronavirus all throughout the United States. And they are far, as you can see from the chart, they are far and away above anyone else. I did make a remark about Native Americans earlier. Because the Native American population is so small, the numbers look small. But our Native Americans, brothers and sisters, are also very, very much struggling with this as well. But here in Maryland, it is African Americans who are being impacted disproportionately. And there is no state in the United States so far in which African Americans are underrepresented in the number of deaths. So for the amount of people in the population that are Black or African American, we have more people than should be who are dying from COVID-19. And this is true in every single state. There's not any state that has it so that there are fewer Black people dying than there should be. So I wanted to talk about a little bit in Maryland. So I created this to let you see that the Maryland population is predominantly Caucasian. 60% of the Maryland population in this state is Caucasian, while 31% is African American, about 5% Hispanic, and 4% other. And I wanted you to think about these numbers as we go on to the next slide. 60% Caucasian, 31% African American. And that's very important because when we look at how coronavirus is impacting the African American community in Maryland, it is astonishing how these numbers have definitely been skewed and made so that there is a huge difference in the deaths and the number of people who are affected. So this data comes from the state of Maryland and is about a week old, so they have not been able to update it, but I took a look at the Maryland data this morning. And Caucasians make up 60% of the population in Maryland, while African Americans make up 31%. However, African Americans currently make up 43% of the deaths in Maryland due to COVID-19. And the reason why this is so striking is that for a population that is almost twice as many Caucasians as there are African Americans, if we were looking at a just system, you would expect that the number of Caucasians who would be dying or getting the disease from COVID-19 would be twice as higher than what you see currently. So what it's telling us is that African Americans are contracting COVID-19 at faster rates than any other race, despite not even making up half of the population. And we make up almost half of the deaths of COVID-19. And in the state of Maryland, here where we live, COVID-19, African Americans have the most cases of COVID-19 than any other. They are almost twice, not twice as likely, it's about one times as likely to have contracted COVID-19 than Caucasians. And so it's very startling to look at this information. And it's very important that we know this information because as an African American community, we need to know how important this disease is and how it can impact us even more. And I found this, I was reading an article today from the Baltimore Sun, and I found this quote, and it speaks specifically of Baltimore, but I'm going to raise that it be for the entire state of Maryland. And it says, and I quote, "I need every single person in Baltimore to understand COVID-19 is real. And I need Black people in Baltimore to understand it 10 times over," he said. "We can see across the country we are contracting and dying of COVID-19 more than anyone else." And this is a quote from Baltimore City Councilman Brandon Scott to the Baltimore Sun. And I really felt like this emphasized and really summarized the information that I'm trying to kind of get across to everyone about how important it is. There are so many people who are spreading so many lies saying that coronavirus is not real, it's not killing people, it's not harming people. And if you come out of this that I'm talking about, if you come out with this with nothing else but knowing that coronavirus is real and that it is hurting Black people 2 to 3 times more than it is hurting any other race in this country, that's all I hope you can come out with. If you don't remember anything else from that, know that we are at risk simply because of the different systems that have been put into place throughout the years. And so it is very real, and it is impacting our community very, very much. From all of the information that is coming out, it is highlighting some of the injustices that have been around for years, but are now being placed on a global scale, to the point that I have spoken with some of my friends who are doctors and nurses in other countries, where they said, "I cannot believe that the United States is so racially, has so many racial differences in the health outcomes," because it is unbelievable when you look at the health outcomes of COVID-19 in the different racial communities and what is happening to people and communities of color. So we have to take this seriously. It's 100% true, and it's 100% real, and it is hurting our brothers and sisters throughout the entire country, and mostly for us here in Maryland. So we kind of wanted to talk about why the difference is, and I didn't want to get too much into this because we could talk all night about the differences and why they exist in the African American community, but several key things kind of came up. The discrepancy between income between those of Caucasian race and other races and African Americans, particularly here in Maryland, and I live in Baltimore City, so particularly here in Baltimore City and other cities and places throughout the state that are at a lower poverty level. Housing, we tend to live in multi-generational households where you will have many generations living in one household, and what that means is that if little baby Joe comes home and little baby Joe got coronavirus from the daycare, and you come home and bring little baby Joe who doesn't have symptoms home, and you live with your grandparents and he gets them sick, it's much more easily spread throughout houses in which there are multiple generations, and that tends to happen a lot in African American homes. Structural racism is a whole nother topic that I cannot go into with the time that we have been allotted, but that's another reason as to why we are seeing so many differences. Misinformation is one of the very big ones. There is not a moment that I do not get on my Facebook or any sort of social media and see so many people spreading so much misinformation. And it can be from anybody, but the amount of misinformation that is out there is truly alarming, to the point that the World Health Organization has termed the coronavirus pandemic the first misinformation endemic, meaning that this is the first time in history when we've had so much access to information that it has overwhelmed us, and it has completely allowed us to read so much misinformation without being able to verify if it is true. And this one is very, very, very big. There are a lot of people who spread information all throughout all sorts of different routes, the internet, TV, cell phones, text messaging, all sorts of things. And that's one of the big ones that has happened and has caused these differences to happen. Another is cultural bias. There was, when the coronavirus first started in China in December of 2019, people thought it was only going to affect those who were of Asian American descent, and that information got spread throughout our government and throughout the media, and has made many people, African Americans and other races, feel as if they do not have to take the precautions because people of authority have told them that this is a Chinese or Asian virus that is not going to harm the United States. But from what we have talked about tonight, it absolutely has harmed the United States. And it's something that we need to really emphasize to our friends and families, that no matter what you're hearing, it's hurting everyone. We had our first patient have COVID-19 in the United States in February. And in 3 months, we have almost had 100,000 deaths and 5 million cases in 3 months. So there's a lot of misinformation. There's a lot of cultural bias that we have to try and combat. Working conditions. African Americans are more likely to work in jobs that others do not want to work in. There are plenty of African Americans who are working in our food services, working as our janitorial staff and our environmental health staff who were exposed to COVID-19, and also working in jobs that don't allow them the luxury of working from home, like so many of us have had during this time, which will impact us from that standpoint. And then the last one is access to healthcare. And this has been an ongoing thing in the United States far before COVID-19 came. And African Americans are disproportionately uninsured compared to the rest of the country, and unable to, or not informed, or be able to understand how to access healthcare, and often dismissed in healthcare as well. And these are some of the things that make up the differences as to why we are seeing such a big impact on the African American community. So the last thing I wanted to talk about before I finish is tips on how to stay safe. So now more than ever, as we are starting to reopen different states and different counties within Maryland, we have to remember that we cannot let our guard down. We cannot just go back to the way things were. We can't go out into every barbershop and beauty salon, all to every store, just because they've opened up, I don't know, TJ Maxx, Barnes and Nobles and everything. Doesn't mean that we have to go to every single one of those things. We need to continue to be diligent and to do what we need to do. First and foremost is a term that everyone is tired of hearing. I'm tired of hearing it. I want to see my friends. I'd like to see someone other than my plants once in a while. But we all have to try and stay 6 feet away from people if we are out in the community. And if someone is getting too close to you, you have to say, please back away. Or you just have to move and make yourself within 6 feet. And I had a question before about why 6 feet. So when you sneeze or cough, the droplets that we let out of spit or saliva are able to travel pretty quickly and pretty far. And being 6 feet is the safe distance in which we know that they cannot reach past 6 feet. So it's very important that we continue to social distance. It's very important that as the state continues to reopen, that we don't go to everyone that we haven't seen in 3 or 4 months' house. Don't go to those cookouts that people were inviting for Memorial Day. Don't go out to wherever you can go. It's getting nice, not packing the beaches, not packing the parks, and all that things. We really need to continue to stay diligent about that, because without a cure, this is the only way that we are able to slow down the disease. And even with social distancing in place, in most of Maryland and in most of the country, we still have a very, very high rate of deaths. And in Maryland, we have a very high rate of cases and deaths. So social distancing, I cannot emphasize it enough. Please just use your phones, call people, write a note, make a video chat, whatever you can do at this point in time, particularly those of us who are either younger or older and have more diseases and health disorders that are impacting us. Wash your hands. I know everyone has said it a million times, but the best thing to do is to wash your hands. Hand sanitizer is great and it's wonderful, but as soon as you get home from wherever you're going, please use soap and water. And that's because of the way that all viruses are created. Soap breaks down their barrier and it kills it very quickly. So please wash your hands. After you go to the grocery store, after you go out to do your errands for the day or whatever you need to do that's necessary, when you get back home, please wash your hands and carry hand sanitizer with you so that in between going from the post office to your car, you can clean your hands on the go. And there has been some information about gloves going out and telling people that they should wear gloves out to grocery shop or to any other place that they're going. And the thing about gloves is that, yes, you can wear gloves. However, if you wear gloves, you must change your gloves every single time you use them. So for us in the healthcare field, anytime we put on a pair of gloves, I have to take those off immediately after I'm finished doing whatever I was doing. You wouldn't want your doctor or a nurse to wear the same pair of gloves going from room A to room B to room C. Therefore, you should not wear the same pair of gloves to go to the grocery store, to go to the post office, to go and get your gas. That is helping to spread more germs. So if you want to use gloves, you can, but you need to only use one pair of gloves per activity that you are doing. And when you're done, you need to throw them away. This one is my favorite. So, I'm gonna move this out of the way so you guys can see this. I graduated from Johns Hopkins with my master's degree, and they put out a really great ad about how not to wear your mask. So masks are very important right now because it helps us to protect one another. And so they put out this ad in which they showed many different ways of not wearing your mask. So for those of you who cannot see the screen, one is called the alley-oops. So these are the people who wear the mask and it only covers your nose or it only covers your mouth, but not both your mouth and your nose. It is important that a covering, whether it be a mask or a bandana, covers your entire nose and mouth, because that is two of the most effective ways in which the virus can enter into your body. The second is the jaunty cap, whereas I've seen people walking around and putting the mask on top of your head. It's not doing anything for the top of your head. It can't help you if you are not covering the places in which the virus would enter, and that is not on top of your head. The third is the 90s choker collar, where you're wearing the mask around your neck like it is a necklace or some sort of accessory. It's not going to help at all. It will not protect your neck from anything. It won't protect you from anything. So you must wear it over your nose and your mouth. And then another way that is terrible is leaving it at home. It cannot help you if you do not wear it properly and even bring it. If you don't have it, you can't wear it, or you can't even be corrected to wear it. So once again, the correct way is over both your mouth and your nose. And it's very important that you wear it, because I went to the post office today and some places are not even telling people that they have to turn around. I went into the post office and the lady who was coming out before me coming out of the post office as I was going in, did not have a mask at all. And I don't understand how she got in or what she was doing, or if no one was able to see her, but people are not taking this seriously, so you have to take it seriously yourself. So if you have your mask, at least you're protecting yourself. And you can't rely on the institutions like grocery stores and things to get every single person. Next is safer at home. So Maryland has opened up in most counties to be opening on very limited basis and a limited amount of people. And so this is what we call the safer at home policy. It's no longer a mandate, or it's no longer against the law that you just stay in your house and only travel for essential work. We know there are now a few places that you can go, unless you live in Baltimore City, Montgomery County, and Prince George's County. Those are the three places in which we are still legally bound to stay at home. But in every other county, like Hartford and Cecil County, it is safer to be at home, even though it's not illegal if you leave your house. You're much safer to be at home. So please, please, please only go to the places that you absolutely, absolutely have to. And if you do want to visit those other places that have started to open up, please be sure to ask your barber or your hairdresser, what precautions are you taking in place to make sure that everyone is staying safe? Because there are many rules out there that the governor has put out for people to do, but not many people are doing them just as they are said. So you have to take it upon yourself to ask the people when you're going out to get your hair done or whatever it is, how are they accommodating people so that you'll be the safest that you can. And one of the last things that I want to emphasize is that what we're seeing in medicine right now is a all-time low of hospitalizations, emergency room visits, urgent care visits, etc. And that is very concerning for anyone who is in the medical profession, because we know that heart attacks, strokes, like flu-like viruses, stomach viruses, things like that, those very dangerous things have not stopped happening. So those things that people were coming to the hospital for, infections or heart attacks or whatever, have not stopped happening, but people are not coming to the hospital out of fear. So if you have any problem at all, regardless of if it is coronavirus or not, please see or talk to a doctor. Do not avoid hospitals or doctors out of fear. And this is a unknown impact that we are seeing now, in which many people are dying at home because they are not going to the hospital or going to the emergency or going to see a doctor because they're afraid of what may happen to them. And so please, please, please go see a doctor if something is wrong. So I just wanted to emphasize 5 points in summary. The coronavirus is something that is very serious. It is new and it can cause a lot of damage. There is no cure or vaccine at this time, no matter what anyone says. There is no cure or vaccine, so please do not try any of the over-the-counter or internet schemes or hoaxes that are out there. Maryland specifically has a very, very high rate of infection. Remember, I said we are number 10 out of 50 states, despite being one of the smaller states in the country. So just remember that even though we are reopening, we still have a very high rate of infection. African Americans are the most at-risk group in the state of Maryland and in the United States. We make up the most deaths, the most cases, and we are very, very at risk. So please continue to social distance, wash your hands, wear masks, face coverings, and be safer at home. But if you need to go out and to do things, continue to do that, but make sure you know what precautions are being put into place. And do not be afraid of the hospital or visiting a doctor. The state of Maryland put out this really great infogram, which just says, stay home, stay safe, stay aware, making sure that you are looking at sources that includes the governor's office, the Maryland state agencies, and the CDC. Every day at 10 a.m., Maryland updates its coronavirus data on coronavirus.maryland.gov, or you can just Google Maryland coronavirus, which is what I do every day, and all that information will be there for you. So those are sources that are true. Things that you see on Facebook or social media or anywhere else, as we like to say in medicine, trust but verify. So if someone tells you something, okay, that's nice, thanks for letting me know, Sue, but you go and verify for yourself or ask someone like your doctor or someone else that you know has the most up-to-date information. And that is the end of my presentation. This is a sign in Maryland. I did not take this sign because I can barely drive as is, so I shouldn't drive and be using my phone at the same time. Someone else did that, but it says safer at home, hon, wear a mask and save lives. So that is my presentation.
Well, Dr. Blake, thank you so much. There are a few questions that have been sent by way of chat.